You are listening to Pharmacy IT and Me, your informatics pharmacist podcast. Hey everyone, this is Tony Dow, and today is Friday, June 21st, 2019, and welcome to another episode of Last Week in Health IT. As with every episode, we start this one stating that the intended audience for this episode is everybody. Today we'll be talking about Sanofi's work with Google, how Vizient and Civica Rx are collaborating on provider needs, how telemedicine helped Texas Health Aetna with saving money. We'll talk about LabCorp and Mount Sinai's AI collaboration, and talk about voice assistants for health. So let's get right into it. Sanofi is a French multinational pharmaceutical company that's the fifth largest in prescription sales. They are involved in R&D, drug manufacturing, and over-the-counter medications. They've enrolled Google to help with leveraging newer technologies in artificial intelligence, machine learning, and deep analytics so that they can better understand the advanced stages of diseases that the company aims to treat. Part of how they are doing this is by using Google's cloud platform as a means to digitize and simplify their legacy data management systems. Once this is all part of the platform, major analytics can be conducted to identify and determine what technologies can be further used to personally treat these disease states. Alright, so Vizient and Civica Rx are reducing Rx costs by collaborating on provider needs data. Vizient is a member-driven healthcare performance improvement company and one of the largest in the country. Civica Rx is a not-for-profit generic drug company, and Vizient will be providing purchasing patterns and provider needs to Civica Rx through analytics and data capabilities, and this will be helping Civica Rx anticipate drug availability, affordability, and any potential gaps. With the major drug shortages happening, this collaboration is much welcomed to show that we need to work together using these technologies and data that we have to ensure patients have access to their medications. Alright, so the next thing is telemedicine platform. It's helping Texas Health Aetna to save $398 per ER avoidance. So one of the major cost burdens in healthcare comes from unnecessary ER visits. Because of this, insurance companies are looking to have ways to avoid them or avoid having these type of visits occur when they could be triaged differently. So Texas Health Aetna tackled this problem by using a vendor called CirrusMD, which is a text-based telemedicine technology. This allows patients to have a direct secure chat with a doctor whenever it was convenient for them, allowing them flexibility for their own lives and also encouraging telemedicine before heading to the ER immediately. After implementing this, they found that over 86% of patients resolved their issues through the CirrusMD platform and got their peace of mind without having to go to the ER. And this allowed for better patient care triage and the cost savings about $398 per ER avoidance. So the next thing is Mount Sinai and LabCorp. They're collaborating on a new AI-enabled pathology center of excellence. So Mount Sinai is a hospital network system in New York, and they contain 7 hospitals and over 6,600 primary and specialty care physicians and 13 surgical centers. LabCorp is a S&P 500 company that's also one of the largest clinical lab networks in the world. The two are collaborating to form the Mount Sinai Digital and Artificial Intelligence-Enabled Pathology Center of Excellence. Chief Financial Officer and Chief of Corporate Services at Mount Sinai, Don Scanlon, says, quote, "The Digital and AI-enabled Pathology Center of Excellence stands to offer major operational efficiencies, extending our joint unique resources and intellectual assets more effectively to improve the lives of patients," end quote. Alright, so the last thing is survey finds that voice assistants can still use improvement. So this headline sounds like, it's kind of common sense because with the technology like, voice assistants, there's always going to be room for improvement. So we've gone through major and massive advances in the past few years, but there are still going to be ways to improve upon them. So the study that produced this headline was one done by ClickHealth and published in Nature Digital Machine. It stated that basically Google Assistant, Alexa, Siri, they all need major improvements for healthcare voice recognition. Although Google did fare better than the other two because it was twice as accurate for medication names. So this is just a matter of additional research and additional time, but maybe one of these days the voice assistants can fully understand healthcare related terms. But once they do, this opens a huge amount of additional potential for healthcare uses. So before we go, if you'd like to hear more news on healthcare IT, you can check out great curated articles at healthcareitnews.com. It's where I go for daily healthcare IT news to keep myself updated on what's going on in that world. Alright, if you guys like this episode, you can subscribe and rate us on iTunes, Stitcher, Google Play, or any of your other favorite podcasting services. You can also follow us on social media on Twitter or Facebook at PharmacyITme, or Instagram at Pharmacy Informatics, or by emailing me at tony@pharmacyitme.com. And I also wanted to plug a great networking opportunity called Pharmacist Connect. If you are familiar with Microsoft Teams or Slack Workspace, think of Pharmacist Connect as a large vetted one through Slack Workspaces. I've met some great colleagues on it, and there's even an informatics space within it as well. You can find out more by visiting pharmacistconnect.com, which is pharmacistconnect.com. Thank you again for listening, and I'll see you on the next episode of Pharmacy IT Me. And remember, technology is the tool, patient care is the goal.